evening, how you doing? And karibu sana to This Is The Day. My name is Sarah Otieno. We are live on Family TV and also live on Family Radio, where the music does the talking. You can contact us through the WhatsApp number 0786 316 316 and also through the SMS line 20316. Through Facebook, if you have any comments, any questions, and you want to reach to us through Facebook or even through Twitter, you can get us at Family Radio 316. That is our Twitter and Facebook account. Today we're talking about our healthcare system. Are we doing okay? So imagine this. You've gone to the hospital of a headache, and you know that maybe and we like Googling our symptoms, and maybe you are convinced that you have maybe malaria, typhoid, just to give an example. And you end up staying in that hospital for about 15 days. Could be legit reasons, but sometimes because of the case studies that have come up lately, there might be a problem with the healthcare system. The hospitals, there has been problems of overbilling, misdiagnosis, and this is everything that we are going to cover today. But first, I want us to look at the structure of the healthcare system. Do you know what kind of hospital you go to? Do you know what level it falls in the healthcare system? So take a listen and please take note so that you know the dispensary near you, the hospital near you, what level it is, and how you can be able to be helped in that facility. So take a listen. So let's break it down kidogo. The national hospitals, now this is a major hospital that usually has a full complement of medical services. And this include maybe the surgeries, the pediatric services, the obstetric services, the general medicine, and also the gynecologists. Then let's go to the county hospitals. All the 47 counties in Kenya each have a county hospital, which is the referral point for the district hospitals. Now, these are regional centers which provide specialized care, including intensive care and life support, and any specialist consultations. Then we have the sub-county or district hospital. Now, each sub-county, formerly known as the district in the country, has a sub-county or district hospital, which is the coordinating and referral center for all the other small units. Now, they usually have the resources to provide comprehensive medical and surgery services, and they are all managed by medical superintendents. Then we have the sub-district hospitals. Now, these are similar to health centers, with addition to maybe a surgery unit for cesarean section and other procedures. Now, many are managed by clinical officers. Well, let's look at other healthcare units that you might find in your area in Kenya. We talk about the dispensaries, the private clinics, the health centers, the nursing homes, and let us look a little bit more into the private hospitals in Kenya. Now, a private hospital is any hospital that is owned by for-profit company or a non-profit company, and it's privately funded through the payment for medical services by the patients themselves. It's also funded by the insurers or the government through the National Health Insurance Program, and sometimes it can even be funded by the foreign embassies. Well, that is just a breakdown of our healthcare system, and by that now we understand what kind of hospital is on what level. We must admit that we have issues, and that has come up today. On social media, if you look at Twitter, look at Facebook today, people are complaining that one of the hospitals in our country, that is Kenya, has been accused of overbilling, misdiagnosis, and this is because of a WhatsApp chat that leaked to the public. And today we are talking about that, and in studio I have Augustine Kinyua, the CEO of Sion Healthcare Limited. Karibu sana.
Thank you very much.
How are you doing?
Very well.
Well, they say doctors are very relaxed, and from the look of things, you're relaxed. Well, thank you for coming and gracing our studios today. So people are saying that the health care system in our country is not doing very okay. And I'll start by giving examples. Have you seen the social media reports what is going out to the public today?
Well, I've seen some clips in social media.
Mm-hmm.
I do not know whether to call them reports or just social media discussions.
Okay.
Yes.
All right. So there is also issue of lack of medicine, and this is something that we have been fighting as a country. There is the issue of doctors and nurses strike that has been occurring in our country over and over again. And someone can also say that delayed services in our hospital is experienced in most, if not some, of the hospitals. Do you think that there is a problem?
Well, obviously, going by what you've said
Mm-hmm.
and what you've experienced in the industry,
Yeah.
the truth of the matter is there are problems, and I don't think this is peculiar to healthcare sector.
Mm-hmm.
Every industry, every sector, all over the world, it has its own challenges and problems.
Mm-hmm.
However, coming to the problems we have in this country, especially in our hospitals, you can build as many hospitals.
Mm-hmm.
But what matters is the quality of care.
Okay.
If you look at the number of doctors that we have in this country, as of 2018, we had about 11,000 doctors
Mm-hmm.
in a population of 47 million Kenyans.
Almost 50, right?
Almost 50 million
Mhm.
Kenyans being served by only 11,000 doctors.
Mhm.
We had 1,200 dentists. I mean, that tells you how stretched these doctors are.
Yeah.
And we also had about 18,000 clinical officers
Mm-hmm.
and about 60,000 nurses.
Mm-hmm.
The nurses may sound as many, but in most cases, especially in the rural areas, nurses are the ones who run and manage health centers.
Mm-hmm.
In conjunction with clinical officers. So the system is extremely stretched, and that is why we have problems in this country.
Okay.
Yes.
So if I'm getting you right, you're saying that the nature at which the healthcare system is at right now is literally stretched.
Extremely stretched.
Okay.
Yes.
Is it because we do not have enough manpower? And even leave aside the issue of staff, if I may call them, the
Yes.
health providers,
Yes.
manpower in general.
Yes.
Do we have the enough capacity of manpower?
Well, if we are going to be specific on healthcare, the manpower we are talking about here are required by law
Yeah.
to be extremely trained and experienced. I doubt there is anyone who would want to take his relative or himself or herself to someone with doubtful qualifications. So manpower definitely will go back to training. We're going to talk about nurses, clinical officers, pharmacists, dentists, doctors, and all this. And the truth of the matter is they are not enough.
They're not enough.
They're not enough.
Okay.
And that is why you realize, because they're not enough, there is bound to be waiting time is going to be affected. You cannot be served as quickly as you'd want. Because, for example, whether it's government or public hospital, if at any point they have about either 3 doctors or 3 clinical officers, and at any given point you have about 20 patients or 30 patients or
Yeah.
the pews, then definitely the waiting time has to increase. And I doubt there is any patient who would want to be rushed once they get to the consultation room because the doctors wants to clear the queue.
Yeah.
If that happens, then the outcome is going to be compromised.
Okay.
Yes.
All right.
So the waiting time, yes, we have some delays. And I can also tell you, quality of care makes a difference. You could have 3 hospitals around, and someone can decide to travel kilometers to go to one specific hospital. Why do they do that?
Because of the quality of services.
Absolutely.
Yeah.
And the patient experience. So quality of care, the outcome of care, absolutely important. Patient experience, extremely important. Now, because of this stretching, if you have to look at the management of our hospitals, sometimes, and you pardon me, I think the public also expects doctors to behave like gods. We are not gods. I mean, hospitals run like any other business.
Okay.
Okay. So if a hospital is going to concentrate on measuring the transaction speed, I mean the turnaround time, how long the patient is taking before they are seen, how much money, what is the growth, these parameters are important. But the best and the most important parameters that any healthcare or any hospital need to measure is the quality of care.
Quality of care.
Quality of care.
And not the money.
And not the money.
Okay.
And the patient experience. That is the backbone. And any hospital which is able to track that, improve on that, you're going to have patients coming from all over just to be attended. And that is it.
All right.
Yes.
So do you think we have enough healthcare facilities in our country to cater for our population?
Not at all.
Okay.
Not at all. I'll give you some statistics.
Yep.
In 2013, we had total number of health facilities in this country. When I talk about facilities, I mean from level 1 to level 6.
Yeah.
Level 1, the dispensaries, the health, the health centers. The level 3, the nursing homes, maternity homes. The level 4 hospitals, level 5, and the 6 referral hospitals, the level 6. 8,600.
8,600.
600.
Only.
2013.
Okay.
2018 was 11,320.
So there was an improvement.
30%.
Okay.
So, and what is happening is because the health systems are extremely stretched, and the population is growing, our economy is growing, we are also getting a lot of interest from external investors, and they're investing heavily in our healthcare system. So going forward, we are likely to have more investors, more hospitals coming up. And if that happens, then it's good for us, absolutely good for us. And at this point, I also need to mention something.
Yep.
If there's anything that we need to appreciate, is that doctor-patient relationship is absolutely important, very significant. And sometimes the public condemns doctors without really knowing what they go through.
Okay.
And I'll give you an example. I do not know what you alluded to, what you meant when you alluded to what is trending in the social media. Sometimes I was in Aga Khan, and I was just there waiting to see some doctors, friends, and all that. Then there's this one man who comes. He's really well built, and you can see he comes. He's taken to the nurses for triaging. The vitals are taken, and then apparently he takes longer time than he expected to see the doctor.
Yeah.
So the nurse who did the triaging comes back, and he spots the nurse, and he springs up from his seat, and he's like, "Why is this stupid doctor? Really? Where is this stupid doctor? My wife is here." And you see, the nurse is trained.
Okay.
She can be able to spot who needs immediate attention, who doesn't need. Now, if we have such kind of interaction, that becomes very difficult. We have 4 levels of interaction between patient and doctors. The first level is whereby neither the patient nor the doctor is able to make the decision. The discussion is cut for whatever reason. Now, if I was the one seeing this patient, or if I was the patient, I would never expect the doctor to be very happy.
Yeah, because there are already names being called.
Yes, but I would want to, I'm not marketing Aga Khan. The other thing, when a patient comes and they are complaining of headache, as you alluded to, either malaria and typhoid, sometimes they have more, internal pain than the physical pain. Some patients could be having more emotional pain than the physical pain.
Yeah.
I understand this guy was referred to a family medicine physician, which is a little bit isolated. It's far from it, it's isolated for the main casualty. Because apparently this person had something disturbing him more than the physical pain the wife was feeling.
Okay.
And even in our setup, and sometimes even in Zion where I work, I'll tell you, sometimes it's good to be very careful when you're handling couple issues.
Couple issues?
Yes.
Yes.
Because I'll bring my wife, and even from the way we are interacting with her, you can be able to tell whether I'm dealing with an emotional issue as the underlying factor, or is the organic or the physical part of it. Okay, so that doctor-patient relationship is important. The other kind of interaction is whereby the doctor takes over the discussion. The patient feels they have no contribution to make whatsoever.
Yeah.
Or whatever that the doctor says or the healthcare provider says is final.
And it's always right.
And it's always right. So you cannot question.
Yes.
Now, this is very common in the rural setup, and sometimes where the illiteracy, the literacy level is not as high. You see, doctors, you're going to give symptoms, they're going to diagnose you from, what you give them. Okay? So if you're not able to interact fully, some things may be missed out.
Yeah.
And that may obviously have an effect on your treatment.
Okay.
Now, the other one is whereby is like this patient, whereby the patient is on top.
Yeah.
Where the patient says, I know I have this and I need this medicine.
And you know, let me just cut you short there. Do you know, I have realized that some of the times we self-diagnose because of Dr. Google, quote unquote.
Yes.
And that is where most of the patients go wrong.
Yes.
Because I go to the doctor with a fixed mind.
Yes.
I already know what my symptoms are.
Yes.
And I'm already guessing.
Yes.
Yeah.
So sometimes you're there and you know what you want. The doctor looks at you, you have the symptoms. Probably he may get one or two things differently from what you expected.
Mm-hmm.
He may not engage you further if you're diagnosing yourself and treating yourself.
Mm-hmm.
He may just sit and make a prescription, go to the lab or go get your medication or whatever investigation that is important, that is required rather. But you see, the level of engagement is not very good.
Okay.
So because you're already on top, remember you're presenting your case.
Mm-hmm.
You deny the doctor the chance to probe you further.
Mm-hmm.
And if that does not happen, then probably even when he is making his requests for whatever investigation that is required, then he may miss one or two things. Not because of his own making, but because you are Dr. Google yourself.
Mm-hmm.
So you end up mismanaging yourself.
Okay.
Now, the most ideal situation, and this is where we want to work with, is the doctor is able to engage the patient well, and the patient is able to respond and engage each other. This is the most ideal.
Okay.
Unfortunately, it doesn't happen all the time. So probably what you're seeing in the media, the patients also need to know that they have a lot of role to play. So we need to have a very good conversation between ourselves, the patient, the doctor, the healthcare provider, and the patient, or the relatives. And then you're going to have the good outcome we want.
Okay.
Yes.
So if I'm getting you right,
Yes.
that relationship,
Yes.
the patient-doctor relationship,
Yes.
is the key.
It is. It is.
Okay.
It is. Sometimes it's not even the medicine or the investigations. That forms the basis of treatment. That relationship.
Okay.
Yes.
Well, let's talk about what has been trending. I'm not sure whether you have looked at it intensively, but it's because of one hospital in Nakuru, that is the Nairobi Women Hospital.
Yes.
And there were some chats that leaked,
Yes.
you know, to the
Yes.
to social media
Yes.
of its internal staff group, and
Yes.
now they were complaining of how the money is going down. Now they have to keep the patients for longer time.
The patient is going down.
No, the money, the
money.
cash
Oh,
flow.
the cash flow.
The cash
Oh, right.
flow.
Sorry. Yes.
The cash flow in the hospital is not very good. So they have to extend the time at which patients are kept in hospital for their own reason. And remember, this is a private hospital, right?
Yes.
So my question is, we have had, resulting from that, we have had people coming out to say, oh, I was kept in hospital for this time, I had to pay an extra amount of money and I could not understand. Others would say, I was very many tests were done on me and no one really explained. Where is the problem? Where is the problem? Is it in the hospitals? Or, as you said, is it just because we do not have a clear communication?
About the Nairobi women's, I am not going to comment as much.
Yeah, because it's under investigation.
And plus, it is
Yeah.
not my facility. So
Yeah.
if I speak, I'll be giving, personal opinion without facts. I wouldn't want to comment.
But is it
about.
right to do that?
It is not right. It is not right. Absolutely wrong.
Yeah.
But the other thing I would want to know is that whoever was saying that the cash is, the money is going down, so we need to keep the patients for longer, I would want to know what position the person holds in the hospital and what qualifications the person has. I'm saying this because if it was purely on money, it is wrong.
Very wrong.
Very wrong. But I'll also give you a scenario. Why do we admit patients? The objective of having a patient admitted is to make sure that their care outcome or the outcome of care is not compromised. That's why you admit,
Yeah.
so that you can monitor the patient, and if you need any close observation and interventions, then that can be offered. That is the sole objective of an inpatient.
Yeah.
Now, we have seen many cases, and I'll tell you one of the cases is my own uncle. He had brain surgery at Aga Khan. I
Yeah.
don't know why I'm referring so much to it, but we had a fantastic experience from there. He was in ICU for about 1 week. Even before the third day or fourth day, my aunt and some of the family members were already discussing on how he can be shifted from ICU to HDU. And guess what happened? From ICU to HDU, and then if you do that, as a matter of time, he started deteriorating. Why? Because we have also had experience, even in Sion, whereby a patient says, I would want to go home.
Yeah.
Because what happened, when you came, probably were unconscious. You didn't know yourself. But the first day, your symptoms are cleared, you're stable, you can communicate, and now you say, I need to go home. But when you're monitored, it is clear, clinically or medically, you still need some observation. So what is the driving force? Why would a patient say, I am better, I need to go home? Yet they never admitted themselves.
Okay.
The question here is financing. Patients sometimes feel they are being kept in the hospital for so long time because they're looking at the cost. But ideally, it is important for us to weigh, the cons of staying 1 or 2 more days versus just releasing a patient because they feel better.
Okay.
So that is the sole reason.
Okay.
But I know there are cases whereby sometimes the hospitals would keep you longer than expected. I cannot comment more than that. But it is wrong.
Send in your questions, any comments, and anything you feel about the healthcare sector in our country, because we'll be here to answer some of those questions and read out some of the comments that you have. And I already have David from Nyahera saying, hi, I'm quietly listening and watching together with my family. Thank you so much for the topic, and thank you, David, for tuning in. Remember, you can text in any comments, any questions through the WhatsApp number 0786 316 316 and through the SMS line 20316. In the meantime, Mr. Kinyua,
Yes.
we have someone who is saying, and this is Lynette, in terms of doctor-patient relationship, I have had a challenge with some doctors not being too keen on what they prescribe.
Yes.
In terms of dosage, there seems to be not enough time to guide the patient. What could be the cause of this?
Which is a very unfortunate situation.
Yeah.
And I'll tell you one thing. It is very rude if you walk into a doctor's room and you realize he's on his phone and he's not even looking at you.
Yeah. And very unfortunate, by the way.
It's very unfortunate.
I experienced that
it's
someday.
wrong. It's wrong, and
Yeah.
it happens.
Yeah.
So going back to a question, in terms of prescription, I do not know what she means that the doctor was not too keen in terms of prescription. Did the doctor miss the dosage? Did he give, even the formulation?
Yeah.
I do not know. Or did he miss the prescription altogether? I don't know.
But what causes all these challenges, all these problems? What causes them?
Well, if you look at the health sector as it is, we have doctors, we have pharmacists, we have pharmtechs. So we cannot have a pharmacist, we have a pharmtech. In the event that the prescription is not done correctly or accordingly, the specialists are always the pharmacists and the pharmtechs. They are there to make sure that these errors do not occur. But I do agree, sometimes error is too human, it happens. And the patient needs to be also to feel empowered enough. At that point, if they had a good relationship, the patient would have said, doctor, please, could you check my prescription? I feel it has 1 or 2 issues. Then if the doctor was also, humble enough, he should be able to look at the prescription and admit or make the necessary changes. We are all human beings. Yes.
Okay.
Yes.
So sometimes it's good to raise these issues when you see them as a patient.
Absolutely.
Okay.
Yes. Absolutely.
All right. Let's talk about the issue of medicines.
Yes.
And for last year, the better part of last year, we had people striking, and the health sector was not doing too well because of issue of medicine and also the strikes, nurses strikes, doctors strikes.
Okay.
And I must say, personally, from my view, it takes quite some time to resolve some of these issues. I mean, hospitals are lacking medicine. Okay, is the problem with the governance, or okay, just help me understand. Shida iko wapi? Why don't we have medicine?
Okay, I can tell you we have medicine in Sion. The government has tried a lot with universal health care that is yet to materialize fully. But if you look at the devolution as it is, the essence of devolution is to make sure health is accessible, is to make sure that the county is able to prioritize their key healthcare objectives, and then be able to meet them. That is the objective. However, counties do not train their own doctors and clinical officers and pharmacists. They don't. They depend on the national government. And I would want to look at the way forward. Now there is a bill that is proposing about the public healthcare commission, just like they have the teachers.
Yes.
Which is important, because what they are doing is let the counties allocate resources in terms of getting the tools, the infrastructure, but let the workforce, the manpower, be managed by an independent organization.
Okay.
So that these strikes can be dealt with, and that is important. We have to agree to that. Secondly, I would also want to state the public expects too much from the healthcare providers.
Yeah.
And I'll tell you, medicine is a calling, and it's also a profession. Okay. I have colleagues who I know, as a matter of fact, at some point they contribute money for the patient. It doesn't come to the public.
Is this for the medicine or for the whole procedure?
This is it.
Yes.
For example, you need to undergo some investigations. And it happens these investigations are expensive. And you're coming from a rural area, you've been referred maybe to Kenyatta. And these doctors feel the only way they can help you is by getting the investigations report, either in the lab or radiological report, whatever it is. You have no money. The more they keep you there, the more you deteriorate.
Yeah.
Such that even if the report comes back, it will be too late. So what do? They contribute their own money.
Wow.
They do that. And I've seen very passionate and very compassionate doctors. That does happen. However, as I said, every sector has its own problems and challenges. The biggest problem in this country, and probably in the entire world, is about financing. Financing healthcare is very expensive.
Yeah.
Training doctors is very, very expensive. And medicines are not cheap either.
And paying them. Umesahau your part. Paying doctors.
In fact, it's good you have mentioned. Why would it that an engineer should earn in the private practice, or even a lawyer, 10 times more? And if you look at how they were scoring, who was the highest? If you have to go, so they also have a right to earn money. Yes. So even paying them is very expensive, because you're telling me if I open my private practice, I'll make my money. If I stay with the government, I'll not even get half of what my colleague in the private practice is making. And that is why we have a lot of I don't know the right word to use, guys leaving the public sector to the private sector. It's all the same.
Okay.
Oh,
all right. I'll tell you a complaint that has just come in right now.
Yes.
I like the discussion. I like the issue of doctor-patient relationship, but also take note that on the medicine, some doctors take advantage of their patients in that they have their own chemists outside, immediately outside the hospital, hapo kwa gate. And I know of some hospitals personally, yenye unatoka tu nje ya gate and there's a chemist there, and you're being told in the hospital, go to that chemist and buy drugs from there. And in most cases, you will find these chemists are owned by the doctors.
I'll refer to what the Dr. Alfred Mutua did in Machakos one time. They realized that could be happening. And what did they say? Any chemist within 500 meters radius of the hospital, license is revoked and closed. Yes.
To solve this problem.
Oh, yes.
Okay.
But.
There's a but.
Yes. There is a but.
Yeah.
What happens if a patient comes to a doctor and clearly the prescription or the drug that the patient needs to get healed is not available? The doctor has to prescribe. Yes. Because we are not going to give people, chemicals for the purpose of it. We are not going to give them placebos. They need to get the medicine that is going to help them. So if it's not available, they have to prescribe, go and buy outside. That's it. Yes.
But I like that move by Alfred Mutua. I like it. Reason being, I will not send you to my chemist, which is immediately outside the hospital gate.
Yes.
Don't you think that was a good move?
It was a good move, but the best move would have to ensure that the drugs are there, available.
Okay, sawa. I want us to look at something that touches on the maternal health before we go for a short break. We look at a complaint that was filed by one woman by the name Alice. Now, this is a phone call that we made a little bit earlier, and please listen so that after this we can talk about it. But for now, Alice, we got in touch with her earlier, and this was her story. Listen up. Hello, Alice.
Yes,
How are you doing?
I'm doing fine.
My name is Sarah,
Yes,
and we are calling you from Family TV and Family Radio.
yes.
So there is a story you shared about your experience and the experience of your daughter-in-law.
Yes.
Do you mind telling us a little bit about it?
No, I don't mind. I'll just say because it is something that it is there.
Mm-hmm.
Yes.
Tuambie, what happened?
Okay. My daughter-in-law
Mm-hmm.
had a premature. She was pregnant of 6 months,
Mm-hmm. 6 months.
but by good luck, yes, or bad luck, she had a premature labor.
Mm-hmm.
So she was taken to Ruben Center in Mukuru slums, where I live,
Mm-hmm.
in Embakasi South. But after reaching there, when she was examined, the doctor told us that she couldn't give birth there because they didn't have the facilities, and the facilities, one was the incubator.
Mm-hmm.
So they were given a referral to Mama Lucy.
Mm-hmm.
Then when she was given a referral to Mama Lucy, akapokelewa tu,
Mm-hmm.
but things turned upside down. Msichana wangu was taken to the labor ward.
Mm-hmm.
She was left there alone. She did everything, akasukuma mtoto. The doctors were just there kulingana na vile she keep on saying. You narrate the story.
Mm-hmm.
And she pushed.
Mm-hmm.
But the doctor was one. The others were just making their stories. The way nurses and doctors do. They do, they don't care.
Okay.
So she called the nurse whom she saw. He came, he was a man.
Mm-hmm.
And he told him, kuja unisaidie. When he came, he found the baby ametoka. Amejisaidia yeye mwenyewe.
Okay.
Na ameshika huyo mtoto na amemfunika, anajaribu kumfunika na leso. Unajua, she's only 20 years. She don't know about delivery.
Well, this is what Alice went through, and I want us to discuss about it kidogo. So she pointed out two issues. There is lack of facilities, and also pointed out delayed services, and literally getting no help. Okay, it came a bit later, but this is after she actually had delivered the babies on her own. Why do you think that is the case? Especially right now that the government is really trying to make sure that there is good maternal health services in our country.
Well, first of all, it is very unfortunate, and sorry to her and the daughter-in-law that it happened. But at the same time, we have to appreciate what the government is doing. There is considerable strides in terms of improving the quality of maternal health.
Maternal health.
Yes. That Ruben health facility where it is, it's right in the middle of the slum.
Yes.
And a few years ago, I don't think whether it had even nurses and the clinicians who could be able to attend to such a case and make such a timely referral. And so the government is doing really well. What it must do, however, is to improve a little bit more on infrastructure.
Okay.
First of all, I don't know whether when the referral was made, she was able to access an ambulance, or even during the transport. Sometimes you may miss an ambulance, but you may also need to be accompanied by a midwife or maybe a registered
And that's
nurse.
a trained person.
Yes.
Okay.
So that in the event of anything, then someone can be able to handle whatever happens.
Okay.
So
Sorry.
so in terms of infrastructure, it's quite a bit of a challenge. But I also know the government through the NHIF, they have tried to partner with the Red Cross. Unfortunately, I don't see, it doesn't seem to work. It is working for the civil servants. So I don't know what about the rest of the population.
Okay.
Now, coming back to her case, you know, if we say we are getting about, about 50 deaths, maternal deaths in 100,000 people,
Yep.
that is statistics. It means nothing. But when I listen to Alice speak, this really struck her. It really pained her, and I can identify with her pain. And it's so sorry it happened.
Yeah.
Now, it is true Ruben didn't have
The
facilities.
Yep.
So it was probably impossible. And even if she was to deliver there, the outcome would have been inevitable.
Okay.
Coming to Mama Lucy, I would just condemn such negligence because that is purely negligence. That is purely negligence. And I wish maybe the authorities would want to investigate this. We have the rest, we have the hospital superintendent, and we have all the consultants. We have gynecologists, we have surgeons, we have all the manner of professions, consultants at Mama Lucy. This is something they need to take up seriously.
So this is purely negligence?
Yeah, this is purely negligence. Okay. If what she's saying is exactly what happened, there is no other term. It's negligence.
Okay.
Yes.
Can we say that sometimes the professionals, the healthcare providers,
Yes,
sometimes just they're not just disciplined?
wow.
Can we say
Discipline is a personal issue. So you cannot single it out to doctors.
Yeah.
Even in a family, out of 3 or 4, 5, there is that one person who is not disciplined enough. So woe be unto you if you befall in the hands of one. And it's a bit difficult, really.
Okay.
So we cannot condemn the entire medical fraternity because of 1 or 2 elements which are indisciplined and have no compassion for the patients whatsoever. But it's really, really unfortunate. Yes.
All right, we have a lot more questions coming in. So, my name is Sarah Otieno. Karibu sana to This Is the Day. If you're just joining us, we are talking about the healthcare system in our country. And in studio, I have Augustine Kinyua, the CEO of Sion Healthcare Limited. Well, I have some questions that have come in, Mr. Kinyua. I must say that I've had good experience with most of the doctors that I have interacted with. We must agree that there are some good doctors, and kudos to them.
Wow, that's great. It's good
That's
to
really
appreciate
great.
them. Yes. Because some of the people who are most unappreciated are the nurses and the doctors.
Yeah.
And I can tell you, some of the most demanding work and the most professionals to suffer from mental health and depression are nurses.
And nurses.
Yes.
And why is that? Is it because they carry the burden of so many people at once?
It is two-pronged. One, they could be overworked.
Because of the stretching again?
Yes.
Okay.
And they have, sometimes if they're offering the critical care part of it, they have to constantly monitor this patient. And they're exposed to the emotional pain the patient and probably the relatives go through.
Okay.
So that affects them. Yes.
All right. We also have Sarah who's texting in. Thank you, Sarah, for texting from Naivasha. Unasema the sector that is supposed to be taken care of is the maternal health care, because this is where we lose so many mothers and newborn children. I couldn't agree more.
I agree,
Yeah?
absolutely, yes. And I also need to mention the government is putting a lot of effort. One, on maternal health care, which we agree. However, sometimes we may not be able to get the results as quickly as you would want them to come.
Okay.
It still has to invest more in terms of infrastructure. And when we talk about maternal health care, we need to appreciate the fact that it is a whole set. It's holistic approach. It starts from conception, from ANC, antenatal, to postnatal care. That process has to be well managed. If the antenatal clinic is well attended and well managed, some of the complications that may arise during the delivery or immediately after would be picked at that point.
Yeah.
And if that is done, then intervention can be, offered so that this patient, the mother and the baby, are well taken care of, either at the point of delivery or immediately after delivery. So we cannot just look at the point of delivery and thereafter. It used to start from antenatal all the way. We have Linda Mama by NHIF, and that one is really doing well for the people who are not able to afford. And there are hospitals which have been accredited and they have signed the contract so that all the way from the ANC part, screening can be done, clinics can be attended, and the proper advice can be given so that at the point of delivery, the nurse or the midwife who has been attending the mother can be able to help the mother come up with a birth plan.
Okay.
And where they're likely to deliver. So kudos to the government. They're doing really well.
And that way the mortality rate will actually go down.
Definitely.
All right. So what about the specific sectors? Because there's a question here. Let's talk about cancer care. Private hospital, over the top expensive, and public hospital is a death trap. This is according to the sentence that has been put here. Now, my sister had cancer, passed on in Feb. My experience was eye-opening, even though I appreciate the contribution of NHIF has made, but we need more help. cancer care.
Okay.
That unit.
Yes.
Kwanza anasema it's expensive.
Yes.
And again, the public hospital,
Yes.
he or she terms it as a death trap.
Okay. Now,
Why?
when we talk about the public hospitals, we have 3 levels of hospitals. Public hospitals, they start from level 4
Yeah.
hospital, level 5, and the level 6.
6.
Now, level 4 hospital is where we have medical officers, and we may not have a lot of specialists. But I can tell you, a medical officer is able to pick most of the symptoms of cancer. They will be able to pick that. So the problem is, the medical doctor suspects. He also wants to order investigations. And probably these investigations, either the patient is not able to do, or is not, if he's not able to do, then the doctor gets stuck. Okay, so the way our public or health sector is set up is whereby we have the basic ailments being handled at the lowest level, and then we have the escalation to the highest level
Through
referral system.
Mm-hmm.
That is how it works. Now, unfortunately, when it comes to cancer, cancer presents with all myriads of symptoms.
Okay.
And sometimes it is not very easy to pinpoint and say, this is cancer. It is going to present with symptoms that will mimic other diseases. And that's why I'm saying an MO is going to pick, if, for example, you have these symptoms, and then he gives you treatment and you come back, an MO is likely to sit down and tell you, I would want you to do 1, 2, 3, 4 investigations, and depending with the report that you give us, we are either likely to handle it ourselves, or we are going to refer you. That is what happens.
And that is where the relationship between the patient
becomes very important
and the doctor
is extremely crucial. But most of our public hospitals are not very well equipped.
Okay.
We have had a very hyped story, so to speak, of in terms of the government and every county referral hospital setting up a cancer center.
Yeah.
I'll say this: you can have all the equipment in the world, without the right personnel to do it,
it's nothing.
it's not going to work. Okay, so we need to have the right personnel who are going to do the diagnosis and the treatment itself. Luckily enough, we also have the role of ICT.
Yeah.
So someone can be able to conduct, there's telemedicine and all that. So you can be able to have screening done at the first level, and because of the technology, we can have exchanges with senior consultants who can be able to give an input that can be able to give a guide on the way forward on the management of the patient. But I do agree, our public hospitals are not very well equipped in terms of personnel and the resources.
Okay.
Yes.
And we must do something about it.
Oh yes. Do you have a choice?
No, no. We don't have a choice about
Yes.
it. And talking of what to do, maybe according to you, what are some of the tips that you can give to help especially improve the health sector in general?
Well,
Maybe to the government, maybe to individuals, maybe to me. Yeah, how can
Well,
we help?
Well, we usually say that prevention is better than cure. So there's a lot of publicity in terms of public education on what you need to do and what you need to avoid, especially for the chronic care. If you look at the top killers currently, it is changed. We are not talking about malaria, TB, and HIV like we did in the 1980s. Now we're talking about, heart conditions, heart-related conditions, cardiovascular system, the cancers, and then the diabetes.
Yeah.
So things are changing, and these are lifestyle. But one thing I need to mention is that even those days, probably these things were there, but people just were not able to diagnose them as early.
And to pinpoint
Exactly
the
what it was.
statistics.
Yes.
Yeah.
And we also had not very many people going to the hospitals for ascertaining the cause of death. So, but we really have to be, alarmed by the state of the chronic diseases taking, the leading mortality rate in the country. So, one is public awareness. The other level of public awareness is that which, empowers the public to be able to engage with the healthcare providers. I think President Kibaki had seen very far when he introduced free primary education, and now Uhuru has brought the free
Universal
secondary
health.
education and all that, and
That's right.
100% transition. Someone who is literate, someone who is educated, they may not have money, yes, but they know what their rights are. They will be able to communicate. They can interact with the world. So that is a very positive step. The only thing we need to do is to tell them, look here, if you can communicate, then you can demand what is rightly yours. You can engage. And from that point, then we can start getting things going right. Okay. Then the other thing is the government has no choice. And I thank the president. When he picked health among the 4 pillars of his legacy, so to speak, he was spot on.
Okay.
A healthy nation is a wealthy nation.
Yeah.
So we have to get it right. But after so long, with all the challenges you're facing as a country, then let us be patient.
Okay.
And I can see what is happening. There's a lot of reforms that is likely to take place in the health sector, and I believe it is for better. Yes. Then the other thing is equipment. Even if you have the best doctors, and for example, a patient needs to be taken to theater, and there is no anesthesia machine, the doctors will be tired,
helpless.
He can't do anything.
Yeah.
So you also have to make sure that the hospitals are running efficiently and they're well equipped. Then the other thing is the role of ICT. This is absolutely.
And I'm really happy because now the government is trying to make sure that they are merged.
Yes.
Okay.
Yes, we need the public hospitals and private hospitals. We need to have the role of ICT. There's something that is very controversial, however.
Yep.
We've heard about the president saying a doctor should not practice outside his location of work. Like if you have been employed as a government doctor in, for example, Kiambu District Hospital or Sub-County Hospital, then you cannot do your private practice. I don't think that is a solution.
Really?
I don't think that is a solution.
What is?
That will not be the solution. What the solution would be, let us have efficient management of the hospitals. Because if you look at the mentality of the public sector, or the public or the state officers, it is very easy for someone to just come in and hang a coat on the seat and walk out. And where does he go? If you look around every county where there is a county hospital, I can tell you, you're going to find clinics for the major hospitals.
Yeah.
100%. These guys go look them there. All right? They're also going to be employed by their colleagues who are doing private business as doctors. They will do that.
Yeah.
So what we need to do is just employ the use ICT. Let people use biometric.
Wow. I
You
like
just
that.
come in, and we know what time you clocked in and what time you clocked out. So we are not going to pay doctors based on their monthly salaries. The issue of your monthly pay is 360,000 per month, and that is it. That is gone.
Yeah.
You're paid by the manpower. That is it.
The inputs.
The input, the output, that is what is. Now, someone can argue, I'll come in and clock in at 8 a.m. and clock out at 5 p.m. That is very okay. I have no problem with that. But with good management, we have queues. We have the queuing system. It is able to show that these patients, this day we had about 200 patients, and we had about 4 doctors. But how come one doctor saw one patient or none? Because when you have an ICT that works and the patients are queued to a specific doctor, you can be able to monitor that very easily. And on a click of a button, you can have the summary.
Wow.
So that works. So let the doctors do locums wherever they are free, whenever they are free. That is their time. Nobody should dictate to a doctor what they need to do with their free time. That is their free time. But then we need to ensure when they're in the hospital, they do the job.
All right.
That's it. Yes.
Well, I think, Leo, that is the best thing I've had. Let them do their job. All right. I have about 3 minutes, but I quickly want to ask you about something that is trending right now, the coronavirus.
Yes.
What do you feel about it? In about just 2 minutes, kidogo tu. It's killed about 17 people in China. And right now, considering that Chinese are some of the people that we take into our country, maybe what are some of the measures that we are supposed to put to make sure that we are not affected as Kenyans?
Well, the problem with this, any viral disease has a very big potential to wreak a very huge havoc within a very short time.
Yeah.
Yes. And in most cases, viral diseases don't have a cure per se. So we just manage them automatically and expect the body is likely to react even before a vaccine is developed. So it's sad it has happened. I was just listening through the radio, and I think we have guys in Kemri who just mentioned that they are putting up the right measures to make sure that there is prevention. One of them is human to human contact.
Yeah.
Because that is how it's going to spread. So I believe the Ministry of Health is going to make sure that they're going to screen everyone who is coming and monitoring, for example, if it was identified in China, this port, and we have a plane coming from this port to this destination, eventually to this destination, and that port was said to have had an affected person, then that we are going to quarantine and isolation such people coming through that plane and that and the ports immediately. That happens all over the world. Yes. So.
Whew, I feel like there's hope.
Oh yes, definitely.
We just need to regulate.
Yes, who is coming in?
Yeah,
and whoever is coming in,
going out.
Yes,
yeah.
Going out, we don't have a problem with that.
But they'll come back maybe with the virus,
Oh yes.
Yeah.
When as long as you know who is coming in, yes, you're absolutely correct. So that regulation and probably doing the quarantine and the isolation of those who would be at risk or those who can spread the virus, and until it is contained, that is the only way I think we can do for now.
Well, thank you so much. You
Most
have
welcome.
shed a lot of light in the issues that are affecting us, especially health-wise, and thank you so much for that. We hope that the health sector is going to improve in our country.
Absolutely, I have no doubt. It is one of the fastest growing sector in this country, and I can assure you, because of the huge opportunity we have in healthcare, a lot of private investors are coming on board. The government has realized it cannot do anything
Without
else.
a good health sector.
So it has to, and it is investing a lot. If you listened or if you looked at the allocation, I think health sector got about 22 billion
Yeah, and
extra.
it's among the highest.
Yes. So Uhuru, well, let us give the man credit. I think he's doing what he can.
Okay.
Sometimes, as you said, we may have those who are not so disciplined, and it cuts across. But I think there's a lot of hope in the health sector in this country.
Well,
Yes.
thank you so much and have a good evening.
Same.
Well, thank you for tuning in today. I hope that we are going to be better, and I pray that we're going to be better. Thank you for tuning in to This Is The Day. My name is Sarah Otieno. I will see you tomorrow. Have a beautiful night.